Oi, now we have to worry about the flu? Welcome to another episode of Ask Dr. David, where we'll be talking with David today about our upcoming flu season. Hi, Dr. David.
Hello again. How are you?
Great. So, I want to talk to you about the flu because we've been so focused on COVID for the last 18 months, and as many people have been hearing, we're now entering into flu season. So, let's just get to some basics about understanding the flu. So, when doctors or other health providers are talking about the flu, what are they talking about? What are they referring to?
Okay, so influenza virus is a family of viruses similar to coronavirus or rhinovirus, adenovirus. So influenza is a virus. When people refer to the flu, there's a more generalness because a lot of times people will refer to a flu-like illness. So, for instance, COVID-19 does cause a flu-like illness. Other viruses can para-influenza as well. But the main thing that a flu-like illness, which is different than a more common cold, that's like a head cold, is that it's usually associated with a fever. It's usually associated with like muscle aches and body aches. It certainly can include respiratory symptoms, but it can include GI symptoms like vomiting as well. And it can cause a lot of fatigue.
Now, if somebody is having these symptoms, should they be tested for the flu?
So there are nasal swab influenza tests similar to many people what they're aware of with COVID. And this is able to differentiate between type A and type B because there's actually two different main categories of influenza, of which there's variants underneath that. So really the question of using it, of taking the test, has mostly to do with if a person's going to want to choose to take Tamiflu, which is an antiviral medication that really should be started within 2 days of starting with flu symptoms. And so there's no point in starting the medication if this is not influenza. So that's really the main reason to be testing people, is to know whether they should take Tamiflu.
Okay. Now, I have heard at various times somebody saying, I think I have the flu. I want to get in touch with my doctor, or I might have to get on antibiotics or something like that. Can you address whether or not antibiotics help with the flu?
Yeah, antibiotics have no business being talked about when it comes to the flu. Antibiotics kill bacteria, and this is a virus that we're talking about. So there's really not any purpose of or any role whatsoever for antibiotics. Now, there certainly are lots of natural things that we can be talking about. We the same things from a preventive perspective that we've always been talking about relative to COVID, having good vitamin D and good zinc levels going into this whole thing, and having good restful sleep and good exercise and all of the things that make our metabolism and our immune system strong, a healthy diet with good bacterial flora, avoiding inflammatory substances like high sugar and words we can't pronounce that are on our labels, because those all can bring increased cytokines. And similar to like influenza, like COVID, there's a cytokine that happens with influenza too, so we want to try to keep them tapped down, because those are the types of infection of the more serious symptoms that people can start to see.
So, if I understand correctly, for most people, if they're having flu symptoms, the main thing that they're going to want to be doing is treating those symptoms using some of the things you just said. They may have fever, so they may opt to take their fever down, or they may opt to let their fever run its course and help fight the virus. I know other people do that. But in terms of antibiotics, I'm hearing you say that is not something that should even be discussed, and that's something that you should run from if somebody's saying you should take antibiotics to treat your flu. So we have the flu season that we're sort of entering now, and I'm wondering what your prognosis is for this upcoming flu season.
So this is going to be a very non-predictable, probably the least predictable flu season that we've had, for a couple of reasons. Number one, nobody had the flu last year. There were like no cases last year. So the level of immunity, of herd immunity that we are going to have, is going to be very, very low. People, the reason why we didn't see it is because people were doing physical distancing, staying home if they were sick, wearing masks, etc. And that's why we had no influenza. But in terms of the, as far as how severe it's going to be, it's also going to be really tough because typically speaking, we kind of have an understanding of what the flu season's going to be like based upon what happens down in the southern hemisphere the half year before, because their winters are our summers. But we're not going to have any of that to look at either, since again there really wasn't a flu season back then either.
Well, and that's a good segue to talking about the flu shot or the flu vaccine. So, the flu vaccine is something that a lot of people are encouraged widely to get every year. Um, do you think that everybody should get the flu shot?
So this comes back to my firm belief that people need to weigh the risks versus benefits of a vaccine or any type of medical intervention, and that way that they can make the best decision, the best choice for themselves as to whether this is something that they should proceed with. So certainly if a person's primary goal is to avoid having a week or so of significant flu symptoms, then that may be a reason why they would choose to take a flu shot. If they live with somebody who is immunocompromised, elderly, etc., that's some reason that way they may choose to. Another interesting thing about this is that unlike coronavirus, children seem to be more impacted by influenza, compared to how they were, how minimally for much of this that we've seen from a COVID perspective, even though we are certainly seeing numbers of that. So that makes it a challenge also, because even, how sick can a child get? Well, between any given year, between 7 to 25,000 children are hospitalized by influenza every year. And somewhere along the lines of between 150 to 400 children do die from influenza complications as well. So there is a morbidity and a more mortality associated with this. Now, of course, one of the things that we highly recommend when people start to get sick is taking our immune protocol with taking high doses of vitamin A to get as soon as things get started, taking echinacea or arabinogalactam, which both boost white blood cell production to help fight things off. Elderberry is an amazing supplement that people can take, concentrated elderberry syrup. Lots of research that has shown that it can significantly reduce the respiratory symptoms faster. There is also research from Israel that shows that it does have some anti-flu direct properties to it. So there are so many things that we can be doing in order to better the ability for our bodies to fight this off.
So I want to go back to talking about the flu vaccine for a while. I know that most people refer to it as a flu shot, but I'm under the impression that there you can also potentially get it through nasal sprays or that there's other modalities with which people can get a flu vaccine. Can you talk about that?
Yeah, sure. So a flu vaccine, if it's done as a shot, is kind of the way people typically think of getting a vaccine, a shot. Now, there's a nasal spray, which is like an attenuated version that can't grow inside of you to cause any kind of symptoms. But I think it's kind of an interesting option because I've always felt that it made sense if a person was going to do a vaccine to take the vaccine in the way nature gives you the infection. So and when a person gets a shot, it bypasses the IgA, the protection that we have on the surface of our nasal passages, on our lungs, etc. And there's a different type of an immune response that happens. There's different antibodies that will show up. There's different types of white blood cells that show up when a person gets a shot for a vaccine. But when they take it as a nasal spray, it's actually from the very, very beginning of the whole reaction. It's totally a natural type of reaction that's happening because it hits the surface IgA, that we call mucosal IgA, to start the immune responses the way it's supposed to be. And then everything else that goes forward from that point forward is also in a very similar way to how our bodies fight off infections naturally, which of course to me in this situation, if we can have an immune response that is mimicking exactly what we would be getting in nature, I think that there's an advantage to that.
If somebody wanted to get the nasal vaccine, the nasal spray vaccine, how do they go about doing that? Because most of what I've seen is, oh, get your flu shot here, get your flu shot here. Where does one find out about even getting one if they decide to get that vaccine?
Yeah, they're available at pharmacies. So in fact, I believe there's a website where you can even look up. Flumist is the name of the company that actually makes it. So I believe you can actually do, and they can tell you which pharmacies or which which sites are going to be giving it are giving it that way. And so, and it is also it should be noted that it's approved for up to age 50. So actually, I'm no longer eligible for that.
I wanted to sort of go a little bit deeper into just talking about the flu vaccine for a second, because this is obviously a big topic. A lot of people come to you to do vaccine considerations, consultations. Not everybody wants to get vaccines at all, or for everything, or for anything. So when considering the flu vaccine, first of all, like the general idea is that they say get the flu vaccine every year, right? So is the flu vaccine different from one year to the next year?
Yes, so that's also part of the trying to predict this. So the vaccine, they decide, a bunch of scientists, like, with the CDC, they try to predict which are the main strains that are going to be seen the following year. That's also something that they would typically use by the southern hemisphere to see what was going on the 6 months prior, which again, we're not going to have that ability for that type of information. Sometimes they get it closer to right, and you can have 60-70% types of reduction of people getting sick, hospitalized, death. But then there are other years where it may only be 40% successful. So, they may be spot on this year, they may not be. I think they do their best effort. I don't think they're trying to make a bad vaccine. They're trying to make them do their best prediction. But I think that there's just a lot of uncertainty as to what should be in this vaccine to provide the most protection for those who choose to get it.
And that is an interesting thing, because it is another consideration for people when choosing to get the flu vaccine or not. Is do they trust the risk analysis of whether or not this year's vaccine may even be the right vaccine for whatever flu is going to be coming down the pike, or whether or not they just want to roll their dice and not get the vaccine and have those odds as well. So, but if somebody did get the vaccine last year or the year before for that matter, we talk about this a lot in reference to COVID antibodies. So now this is like, all of a sudden the public is learning everything about things that we never knew about. If somebody had a flu vaccine last year, do they still have antibodies in their system this year? And is that something that can be tested?
Yeah, good question. It's not something that's commercially available to be tested. Thankfully, we now have COVID antibody tests, so people can know whether they have a robust immune response. We don't know what the protective level is, but there's no antibody test for influenza for us to answer that question.
Okay, so we really have no idea if somebody got the flu vaccine last year, they may or may not be still having some level of immunity against whatever variants or strains that particular flu vaccine was targeting at that time.
That is correct.
So let's talk about if somebody decides to get the flu vaccine. Um, when should they get it, in terms of, right now we're recording this towards the end of September, beginning of October. Optimally, when would a good time be to get that, in relation to flu season?
So if one's going to choose to take a flu vaccine, the obvious is before flu becomes endemic in their community or where they may be traveling for. So, often up in the north, they start to see it sooner than we do down here in the south. So that's kind of an interesting pattern that we see. The CDC recommendation is to be taking it October, November time before that comes. So that's the more standard recommendation that comes. But obviously, a vaccine is going to be protective for somebody when they're exposed to it. So, are there some people who may even say, well, when is it going to start going? And then we'll do it at that point. But then, of course, it's in the community. So this is around the time where people would start to be thinking about it.
So I know, again, I keep referring back to the COVID vaccine because that's just something that we've been told a lot about. They say that you don't have full immunity until 2 weeks after your last dose or whatever. Is it like that with the flu vaccine at all? Like, is there a lag time between when somebody gets the flu vaccine and when they are actually having some level of immunity against whatever the strain was that vaccine targeted?
I would expect it to be similar because our body still has to mount the immune response. Our body has to first make what are called IgM antibodies. Those are kind of like amongst the first responders. And then, as we've heard people talking about converting over to IgG, and that's something that typically takes several weeks, 2 to 3 weeks to do. So I think it's probably safe to say it'll be in a similar mode.
Okay, a couple more questions and then we'll wrap up. If somebody is going to get the vaccine, Are there things that they can do to kind of prepare their body to minimize the likelihood that they're going to have side effects? I know some people get the flu vaccine and then they could feel really fatigued. Their arm can hurt. Some people might even get a little fever, like these types of just responses that happen. Is there anything that people can do if they want to prepare their bodies leading up to getting a flu vaccine if they choose to do that?
Yeah, and this is where we could say insert COVID answer. The as everybody knows, to me there's both building up long-term immunity, making sure that people have good vitamin D levels and zinc, red blood cell and plasma levels. And as I've said, I suggest people aiming for the middle part of the range, not just barely getting by. And obviously you've heard me say that also for if people were to catch the flu. So having good vitamin D, having good zinc levels is an important thing regardless of what type of stimulation to your immune system when you want it to react properly. Okay. Also, similarly, we recognize that this is inflammation that is causing the symptoms. So things like high dose omega-3 fatty acids, curcumin, quercetin, again, having good vitamin D and zinc, vitamin C as a wonderful antioxidant. Oxidative stress happens when you get an infection. An antioxidant is able to beat that back. Selenium. So there's so many things that people can be doing in general. And then of course in our practice we recommend same thing for when you actually get sick with it, is starting the 2 days of the high dose vitamin A, again the higher doses of vitamin C, zinc, again echinacea or arabinogalactan. So it's really I look at it the same way. If you're going to catch the flu, you want to have these things on board ahead of time, and you want to start taking them as soon as you get sick. So it would make sense to me that it would be a similar type of thing for here.
Yeah, and I do want to point out one thing. I know that Dr. David, a couple times during this episode and in other episodes, has talked about high dosages of vitamin A. There are very specific doses that are appropriate and for very short amounts of time. So, if that is something that you are going to consider doing, there is additional research. We have some information in some of our other videos. If you want to set up a consultation with one of the practitioners at our practice, all of our patients have access to very detailed information regarding dosing of all different ages for vitamin A. So that's not necessarily something that people should play around with. It's not that everybody should start putting high doses of vitamin A in their body for extended period of time. Is that right, David?
Absolutely, and especially when it comes to vitamin A. Vitamin A, for a vaccine, we typically say do it twice a day, the day before, the day of, and the day after the vaccine. We suggest doing it for 2 days on the first start of illnesses. So that is really important. A person who takes high dose vitamin A for longer periods of times can actually hurt their liver. And there's actually another thing called pseudotumor cerebri, where it can actually increase intracranial pressure and almost like appear like a person's presenting with a tumor. That's why they call it pseudotumor. And this can take a while to come back, for these pressures to come down and for the liver to turn around. So yes, one should not be just taking high doses of vitamin A. It should be done under the supervision of someone who knows what they're talking about.
Right. So we'll wrap this up by just talking about one other thing that I find to be very interesting. Um, Compared to where we were 2 years ago as a culture, many more people are used to wearing masks, or avoiding crowded places, doing physical distancing, washing their hands more, sort of things that health professionals have been encouraging people to do for a long time. I'm assuming that those are things that would potentially also really help people avoid potential exposure to the flu as well. Some of the same practices that they may be putting in to avoid getting coronavirus.
Well, and that's what we saw and why we didn't really have a flu season last year because of those very things.
Yeah. And, obviously, I think that we live in a culture now. I know the other day I was somewhere and somebody sneezed, and it's like everybody turns around, fearful that this poor person who was apparently just having allergies, has COVID. So, like, we are in this sort of heightened state right now where I think a lot of people are kind of looking at this. But I do think that more and more people are realizing, and hopefully more and more employers as well will realize, to not encourage employees to come to school if they're sick, or kids to go to school if they're not feeling well, because as we've seen with COVID, that's how it spreads. So, hopefully that is one of the things we'll be seeing this year.
Yeah, people should not go to work Students should not go to school if they're sick. They're going to pass things along. And, I realized that one more thing. I mean, people are being quarantined and not being able to go to school because they've been exposed or because they have symptoms or they're not sure. And so, I realized that this is a big potential hardship for a lot of people because obviously keeping home from work or keeping your kid home from school also requires childcare and all of those types of things. But certainly, as a society, as a community, we want to protect ourselves, but we want to protect everybody. That's a important part of this great American melting pot, is that we're all in this together, and we really want to make sure that no matter who we are, that we don't get other people sick, and that, of course, that we take care of ourselves. When we get sick, there's a reason why we get fatigued, because we're supposed to rest. We're supposed to chill. We're supposed to take our chicken soup. We're supposed to drink lots and lots and lots of fluids, something we forgot to mention before. But fluids being so incredibly important to help fight off infections, and especially influenza, and taking with electrolytes, or making sure that there's, even like taking some water with some chips because of the salt plus the carbohydrate that's there. So, make sure that everybody stays well hydrated, because once they get the dehydration, things can really start to spiral downward a lot faster.
Yeah. All right. Well, we're going to wrap up this episode of Ask Dr. David. We've obviously covered a lot of ground related to the flu. It will be certainly interesting to see as things unfold in the coming months, whether whether some of the ideas that people have about this flu season will come to be. We want to remind you that we have a lot more videos on different topics that you can find out. Please subscribe to our channel, and we look forward to talking with you again soon. Have a great day.
Have a great day, everybody.